Very good.
Okay.
Welcome, everybody, to today's 8th session of the eRise eLearning community, Assistive Technology and Employment. I am going to begin today by sharing some various resources that exist that you might find useful in the work that you do with others and generally for yourself as well. Following my sharing of those resources, we're going to take a little break, and then Jennifer's going to join in, and she's going to share with you a wide variety of examples on how to standardize models, how to get past the handshake and work with employers and help prep and prepare both the vision within your organization as well as assistance you might be offering to your clientele. So, Donald, if you'd like to go to the next slide, please. So here's a list of some general employment disability resources. Donald, would you click on the Explore AT? Thank you, Donald. Now, would you scroll down the page, please? You can see this is a part of the AT3 website that allows individuals to explore assistive technology. Slow down a little bit, Donald. Go back up. I want to show these categories. So here on this particular website, you can find assistive technology related to hearing. You can look for speech and communication. You can look for AT to support vision, computer access, AT for daily living. You can look for assistive technology for recreation, as well as environmental adaptations, vehicle modifications, seating, positioning, and mobility. Now, if you scroll down just a little more, there's also a section for learning, cognition, and development. So you can find resources for reading, writing, mathematics, as well as organizational tasks. And scroll down a little bit more. Some explanation about how to find and buy assistive technology and accessing state AT programs. You can scroll a little more, Donald. Go a little further. Thank you. And a little further yet. And here is a whole list on this website of other organizations that will offer support and information to support you in the work that you do. You can stop sharing this website now, Donald, and go back to the original PowerPoint.
Sorry, I'm a little slow.
That's all right. Is it not possible to go directly to the links from the PowerPoint?
I'll do that.
Okay. So let's go to, yes, to the EARN website. Not as smoothly as I thought. So this is a website designed for employers that you might share with the employers that you work with, who might be looking to recruit, hire, retrain, and advancing qualified people with disabilities. Could you scroll down a little bit, Donald? So you can see it's broken up into sections for recruiting, hiring, retaining. It has strategies for disability inclusion, and some other resources like a mental health toolkit. And Donald, will go back to the regular PowerPoint then? All of these resources will be embedded in the documents, the PDF document that you've received, so you'll have access to them. Let's try the Job Accommodation Network. So Jan is a great site. It's been around for a long time. You can search it. It has sections for employers, employees, other folks, updated regularly with lots of information. Webcasts, free training events. Lots of blog posts, interesting information. And Donald, go back to the main PowerPoint. I know we have an awful lot to cover, so at this point I'm just going to go through and kind of highlight these resources as opposed to visiting each of their websites. We didn't quite get everything done that we wanted to do last week, so I want to make sure that Jennifer has plenty of time. So the last
I'm good, Dave, just so you know, with the I changed my structure around so it'll fit in. So feel free to take the time you need.
Okay. Let's see, I think we just had a message from Linda. Sometimes with Jan, you need to make sure people you refer to the website don't download the entire list for their employer and try to insist that all the accommodations listed must be in place. That's a good point, Linda. Absolutely.
Yes, a very brilliant attorney lost her job because she tried to do that.
Yes, we need to keep our requests for accommodations specific to who we are. So let's go ahead and look at the APSE, the Association of People Supporting Employment First. So here's APSE, and they explain right away what Employment First is. Employment First means that employment in the general workforce should be the first and preferred option for individuals with disabilities receiving assistance from publicly funded systems. Simply put, Employment First means real jobs for real wages. That's a constant push, and you probably all have been involved in that in one way or another. But APSE supports you and it supports the people that you serve as well. So another great website for additional supports and information. They have events and learning opportunities. They have plenty of news releases and information on policy and advocacy. So this is another great site. Donald, you can go back. And let's go to the next slide, please. Whoop, back one. There we go. And of course, we would not be complete without sharing the information for Able Opportunities that Jennifer and her team have worked so diligently to put together and support out there in Washington State. So we wanted to make sure you had all of that information at your disposal. So here is a link to their main website, as well as some links to some of the materials that they've created for teaching iPads and the virtual teaching tools, sequencing tasks, the work autonomy application. They have video resumes, which Jennifer has spoken about in the past. And then there's also a link there for the Vocational Rehabilitation TA Center for Quality Management. VR is out there too, and I know that some of you work closely with them. So we can never forget our VR partners when we're trying to support people with disabilities in competitive integrated employment. So these resources are available to you in the materials that have been sent to you, and I hope you take advantage of them. They are just examples of many, many other resources that are available. Earlier, as we prepared for this course, the Disability Employment Technical Assistance Center provided you all with an AT toolkit for employment that we created, and I hope you will refer back to that document frequently. It also has a long list of resources included within the document. So at this point, I think I'll turn things over to Jennifer, and she can begin to share her information.
Well, thank you, Dave. It'd be good to just take stock of, do you know, how many people have actually visited those websites? Anybody in chat? Any one of those that you've used regularly or has been a regular resource for you? Or has anybody used all of those websites? I think that's probably the bigger question. Do you know that all of those resources are out there? So of course, all of us trying to manage all of the resources that are out there. I do visit many, Leslie says most of them. That's fantastic. And just to know that especially during COVID and as monies have moved into strengthening accommodation tools and access to accommodation tools for people with disabilities, that the websites are updated regularly. I'm surprised by how often I have to go to them now to actually stay pretty current. So just an FYI. All right, Donald, if you want to go ahead and move us to the next slide. All right, I'm going to go back and recoup the business-minded structures that we were going to cover last week but didn't get to first. When we talk about, and so I know we're kind of jumping from topic to topic today, so thanks for traveling with us. When we're talking about the employer, you saw early on in our first presentation, I think, or second presentation, the statistics that we've gathered at Able Opportunities over the last couple of decades when we interview people who support people with disabilities, teachers, and families. When we ask the question, what is the biggest barrier to employment, we are overwhelmingly in agreement that the biggest problem is the employer. Their discriminatory practices or their lack of experience or exposure, their ignorance. When we ask employers that same question, we get a different answer. The majority of employers say, I've been trying to figure out how to do this. I'm interested in doing it, but I don't have the time or the money, which means we've taught them a capacity model. It's a separate and not equal employment structure. Now, we need specialized strategies, customization of jobs, that kind of thing. But we've separated ourselves so far from the business model that they don't trust us as business partners. The second reason that they give around not hiring people is that they had a bad experience with one of us providers. So in order to kind of think about how to right those imbalances, we're looking very strongly at how to make sure that not only am I thinking about the person, the employee with a disability and the technology tools that they need to access their job and work as independently as possible, I also want to think about the employer and what kind of technology and what kind of tools do I need to be prepped with to engage with them so that I'm accommodating both customers. So I'm going to give you some concise examples. The template, staff science, okay. So we create concise templates on our staff iPads so that when we're pitching to an employer, when we're looking at customizing jobs, we are with the employer able to input some data and get them information right away that can be emailed to them as a PDF right after the meeting. When we're working on job development, as we know, right, our current practices are based very strongly in the handshake. I know you, I'm a friendly person, you can trust me. The biggest reason people with disabilities lose their job is because now I'm not there and a new person is there, or there's a new supervisor and they come in saying, uh-oh, that's Jerry's kids, essentially. That's not, I don't know how to do that. I'm in a new job, or I have other priorities right now. So we're missing that mark. And this capacity to walk in with strong business-minded tools prepared on your device is a very helpful interactive process with an employer. We're finding great success if we go in with possible models to show people about how business-minded we are now. Fantastic. That handshake process that we've been so strongly embedded in for a long time, I meet you, we're partners, you're my employer, I'm your support person, has also built this structure of I will be the employer of this person, and it disconnects the employer from their own employee. That's problematic as well. It also means that the person I've talked to is the only one who understands who I am, what my role is, you know, how this position came to be, etc. So what we're interested in doing is presenting and providing accommodation tools to the employer that lasts beyond the one person that you're talking to. And I'll give you some strong examples of that in the next couple of slides. But essentially, if I go into an HR department and I'm talking about it, you know, somebody has applied or they're asking about an open position, and the supervisor or the HR person says, gosh, yeah, we're interested in hiring more people with disabilities. They're not in charge of that FTE, that full-time employment, you know, the position itself. You want to make sure that you're creating tools that you can give to that person. So the language and the framework that you've worked so hard to develop actually carries forward. Because most of the time you find your internal ally, they go to the next level to talk to maybe leadership in some form, but they don't have enough experience around this or background most of the time not to bring it into that charity model again. Even if you've spent time getting really strong business language around it, their whole life experience is going to bring the landscape that they understand. We want to do the right thing. We want to hire somebody with a disability. This poor guy is looking for a job. That whole interaction, that kind of operator game that continues to happen, the telephone game, you know, where you talk to one person and then that person talks to the next person, and by the time you go down the line, the message has changed. We need to standardize how we work with employers so that we're not asking internal folks to try to explain. So you want presentation materials, even in your first interaction talking about one job, to help represent what it is that you're doing, what the employment first model is, and that there's enough data and written information on what you're providing that the next person to look at it is going to read the same thing. You're essentially capturing your elevator speech, making sure that it's getting passed forward correctly. All right. And then, of course, every tool that we make, because if you're working on a device and you've put together a cost analysis sheet, for example, we're going to get into those soon. I've got the template, and then I've got models for the hospital that we work in and other places where we've developed jobs, because the template might be what I bring to an employer, or I've prepped for them and I've put their name in it, but I don't have the data yet to complete it. So I'm going to have a model of what this could look like. And in our first conversation, I'll be able to develop a model that is specific to their company. So you want to have things prepped so that in that meeting, you're leaving them with this material. And again, creating it for the CEO's desk. If you were able to talk to the CEO right now, the language of that story needs to be in the documentation that you're providing about employment and employment first models. Because as soon as I'm done that first meeting, I'm sending that material so the person has it to have the next conversation. Donald, if you want to hit the slide. All right, so here is the data that we make sure is in every conversation. In every PowerPoint, essentially we've presented, besides here's who Able Opportunities is, right? And here's what we support people with disabilities to work. We want to give them the why and the how immediately. Here's the why. There are almost 21 million working age adults with disabilities, and unemployment rates are more than twice as high for people with disabilities. Here are the statistics from the 2019 annual report from the Institute on Disability. So you're giving them this information to say that there's inequity exists, and companies now really understand, right? It's diversity, equity, and inclusion. So it's much more in the forefront of dialogue with companies. You are an expert in helping them get to equity. Our job is to help develop those tools and those strategies and those models. All right, next slide. All right, and then the other thing that we do in prep, so the first one is a factual slide that shows here the statistics and the why. And then I've gone to your website and I collect data about what your mission is. Your mission and values are going to be presented on the left side of this slide. And then on the right side of this slide, I'm going to present to you how I can partner with you in a project or in hiring practices that help you meet the goals of your mission and that meet your values. So for example, building community, that might be part of your value as a company. And what we provide is, well, we can support, we can support you to get to an employee base that reflects the community that you serve, where 19% of people have disabilities. So you've got representation in your employee base. If embracing differences is something that you value, then we're going to talk to you about hiring from a group of people who are most impacted by poverty, and that this is an opportunity to break the myths of employability. You might be interested in innovation. Innovation comes up in a lot of websites. A lot of businesses have this as one of their values. So we talk about being able to provide on this technology, cutting edge, low and high tech accommodation tools and accessibility strategies. And then diverse perspectives might be another thing. These four on the left-hand side come up regularly, which is why I'm using them as examples. So diverse perspectives. Well, with people with disabilities leading a dynamic action plan, that's going to foster growth in the company because you're going to get to equity more quickly. So we prep a collaborative vision before our first conversation with the employer, even when we're talking about one hire. Because again, we're making it for the CEO's desk, because soon we're going to talk about what if you hired 2 people or 5 people or etc. All right, next slide. This is the bread and butter of what changes how we do business with employers. We in that program at the hospital that I've talked about before, in our first placement, we did a pilot. And we took 2 people off of my caseload, like we typically do business, right? And put them in a position when we found the employer who was willing to work with us. We weren't matching skills other than we know these are 2 hard workers. We just took whatever job was open in whatever department had an employer who said, yeah, come on in here, we'd be happy to pilot this project. So from there, we started to change the story of how we typically do placement. The first thing that we did, we took film after that first pilot and we brought it to the leadership committee to show how the pilot had performed. And it was a good story and people all were happy about the outcomes. But the thing that really struck me and surprised me and woke me up was the fact that the supervisor of one of these people said, gosh, I can see patients for an hour and a half more a day than I could before because I was, doing the things that now this person is doing. And it dawned on me, wow, this is money. This is about money, right? This is where we can start talking about the bottom line of employment. This is where math breaks the myth of employment of why to hire people with disabilities, especially when you're customizing positions. So this is a customization model. This is actually Eric's job when we first pitched Eric's job back in, let's see, it's been 7 years. So 7 years ago, we pitched it at almost $16 an hour and got it. In fact, our pilot positions, we pitched at $10 an hour when minimum wage was $7.25, and we got it. Because we're using math to break the myth. We're showing compare and contrast of what you're paying right now to get these tasks done and what we could do by customizing positions and taking things off of higher paid cross-trained staff. Now, it's not that Eric or Reed or Robin, it's not that people are less valuable than their coworkers. It's that there are different skill sets in employment, in the business world. a couple of decades ago, we moved very strongly into cross-training. Cross-training means you're going to stay with me longer. If I hire you as a dishwasher, I'm going to train you to be a sous chef, a prep cook. And then once you've got that skill set, I'm going to offer to train you as a chef. Now I'm helping support your career development. And employers realize that if they invest in people, they stay longer, et cetera. Now that took out a lot of jobs for us because we wrote repetitive jobs for customized positions can be very helpful. So we put math to the story that they were currently using. Yes, I understand that you can cross-train people, but now you're talking about people who have a very high skill set, stocking and supplying and returning equipment and things that don't require that kind of cross-training. So this is the partnership for us. We start talking with them about the money deferred from taking those tasks off of the cross-trained staff and pulling in a support person with a disability to complete those tasks to help the flow of the entire department. So what that chart is showing you is a smart hire. We use that vague language when we're teaching about this. We have a program name on ours in the hospital, but a smart hire, for example, at 40 hours a week, making $15.75 an hour, as compared to who was doing this task before Eric was doing it. Now, Eric builds patient trays with medical supplies that are stored in patient rooms in locked cabinets. So before Eric was building those trays, the warehouse clerk was doing it and the supervisor of the warehouse was doing it, because it's medical supplies. And that's their hourly wage. So we're comparing and contrasting the money that they're spending right now is essentially bleeding money, right? That's going down the drain. And if you look at that right-hand side, we write in here again for the CEO's desk because we want them to know, we want them to read it and know exactly what it means. And here's what it means. Matching tasks to the gifts and strengths of your employees makes good business sense. Based on a 40-hour position, a smart hire could defer between $18,000 and $108,000 of revenue over a 3-year period. Funds generated could be earmarked for the cost of the FTE. Customized positions also recoup revenue from higher paid cross-trained staff who are now freed up to increase attention to additional revenue from direct customer service and/or production. We're not even calculating that in this math. We're just talking about a straight across, who are you paying, how much are you paying to get this task done? Now with this kind of chart, this is also very helpful if somebody's working at 70% rate of their coworker, the math still works in our favor because of how much it costs to do menial tasks, not menial tasks, but rote repetitive tasks. So let me correct myself. I'm so sorry that word even came out of my mouth. Fascinating, because it's not menial, it's rote repetitive. So a good example of that, and one I use a lot when I'm talking to an employer, when we're going to go to a department, and we're going to observe the flow of materials in and out, and we're going to view a flow of the services provided in and out. I'm not looking for just jobs that fill the printer paper, and I'm looking for everything that's coming in and out. So for example, in a hospital, they're putting, they have surgeries and all the material comes down to a sterilization area and they clean it all, and then they have to repack surgery kits. Now there are 215 kinds of surgeries that happen at the hospital. And some of those kits contain 167 different medical tools, but it's the same tools every single time. Those are the kinds of jobs we're looking for, where being precise and clear and being able to follow the pattern are helpful to the person with a disability and really helpful for the hospital in the wage that the dollars that are deferred, because it's typically in the hands of somebody who has more cross-trained skills and is operating the whole department. So any questions about that before I move on? Cost analysis as a concept. Okay, nothing in the chat box. All right, go ahead and move on to the next slide. All right, so what I just finished was the business-minded kind of strategies. If you have questions about that, we do a lot more than those 3 slides that I gave you, but those are the basics of starting to think about how am I engaging with an employer, how am I presenting this, and I'm going to just give you again, I think I've said this to you before, but give you the example of in this hospital where we run this project and have really honed these business-minded tools. They've been bought out by several iterations of big health companies. And now they've changed their name and they've settled in this enormous conglomerate owns them now. And they brought in their own HR department. So we lost all of our partners. We didn't know anybody in the building. Well, we know the people in the work floors, but we lost our partners in the development process of these positions. And when I called the new HR director, her first statement to me was, yeah, we're not going to have time for a project like this anymore. We're changing, we're growing, we're trying to combine we're merging companies. It's too much to have a special, she called it a special project. And I said to her, I understand completely that you're used to the Jerry's model, Jerry's Kids model. That's not what we're doing here. We're talking about employment for people with disabilities. And we have a very strong business-minded strategies in place to do this. We've been a strong business partner for the hospital. I just want 15 minutes of your time. And after that 15 minutes, if you feel the same way, we'll pack up our stuff. And instead, I go to the meeting. She begrudgingly gives me the time. She's exhausted. She's overwhelmed. I come with cost analysis for every position in the hospital that shows the math about what's happening financially for them by having these supported positions within their departments. And then I also have the work autonomy app. I have the charts of production from each of these employees. So she studies them. The first 5 minutes of the appointment is her actually reading all the documents and studying them. And then she looks at me and she asks me if we can do this for her in 2 other hospitals. That's the change. This partnership has to be that I'm helping make sense to the business model for the employer. And again, we have lots more tools that we use, but that's the basics of the basics of it, the most important pieces of it, and the cost analysis. If you want a copy of that, our pretty version that you're seeing there is made in Apple products. We do have an Excel version of it. It's just not as pretty. So if you want to take a look at it, you want a copy of it, just give me a shout. All right, now we're going to move past the employer engagement piece because we're now condensing our work throughout these slides into building a training library. Building a training library around technology is going to be necessary. And I'm going to relate it to you as to why. You, for example, want to learn how to use a new app, or you want to learn how to do something new in Microsoft Word or an Excel spreadsheet that you haven't done before. What do? You go to YouTube, you look it up, you find some teacher, from 7-year-olds to 70-year-olds are teaching all kinds of technology, and you find a teacher you like. And, my favorite story about using YouTube is I carry the round zip bags that have the background drops, the green screen and blue screen or black screen and white screen for filming, because we make a lot of film. And I can never remember how to put that thing back together. And I've, just tagged a site that I go back to, and the guy gives me the visual. It's how we learn a lot of skills these days. Now, technology it requires an ongoing training because it changes every year. They update the iOS, the operating system of the technology. Smart technology is going to continue to look different. They move where the button is. They move how the button looks. Sadly, they're still not working with us enough to understand that affects accessibility for a lot of people. So we make what we call how-to documents and film. And we highlight in very large ways with big, here's the push this, do this, this is how it works, so that people can walk through how to follow along. Making how-to documents is not a new job that you have to develop in your company. We make this part of our work with the individuals that we serve. They make documents with us, If they're learning how to make film so that they can make a self-advocacy film, they're helping make the self-advocacy how-to, because it helps them develop the skills. Now we're in billable hours, so we're not trying to figure out how to do this on top of everything else that we're doing. You want to leverage all the partners that you have in building a training library. Now, Dave walked you through all kinds of brilliant websites that are out there that have all kinds of materials. Some of them are accessible to people with cognitive disabilities, some of them harder to follow along. So for those harder to follow along pieces, we start working on visual, concrete ways to strengthen those skill sets. So I'm going to say here, there's a couple of things. Kim Enloth, of course, from Perspectives in Rhode Island, a lot of you know her, says, many hands make light work. So there's the strategy, making sure that you're working on the development of tools as skill building for staff and customers. And I see Marianne says in the chat box, I learned how to edit videos and photos in Adobe Premiere Pro, video editing program from YouTube for a part-time job. And that's actually how a lot of us are gaining technology skills. So what we want to do, because one of the tools that's helpful for everybody I support, and we support primarily people with developmental disabilities at the hospital now in our direct service, is I don't want to make a document for you. I want to teach you how to make the document, so the next time the iPad updates or the Android updates, you know how to make the changes in that document as much as possible. You want to bring everybody along, so we're not, again, developing a new position that we need in our companies just to keep up with teaching materials. Okay, so I'm going to see Donald. I'm sorry I didn't make it a live link, because, you know, there you go. If you could take that and open that website, that would be fabulous. So you're going to go to ableops.com. I can walk you through it, actually. You just want to go to the website, ableopps.com, and then I'll walk you through the tabs to get there. I want to show you some examples of some how-to documents. We make how-to documents and how-to film, depending on what it is that we're teaching. And around technology, this is so important. So Scott, I'm going to use you as an example. If I got to work with you, what I would do is I would bring the library of what I've developed so far to teach iPads, and I would ask you to help me work with the community of people with lived experience to review them and revise them so that it worked for them, because it's only coming from my lens right now, right? All right, I'm on this page, so I'm going to stop talking to you, Scott, and I'm going to pick on you again later. So in this, on our web page, if what he just opened up is that free tab on the right-hand side, and I'm just going to ask you to go ahead and point to it, right? And there's teaching iPads, and then there's tool for virtual delivery. And if you'll slide down there, scroll up. Thank you. Stop right there. Just in the free materials, so that you know we have a justification letter. So if you're working with someone to be able to get an iPad, or to get a Microsoft Surface, or to get an Android phone, or to get an Echo or an Alexis in their home so that they can open the blinds and turn on the lights and control the temperature, etc., then this is a letter that says, in general, here's how smart screens have become an amazing accommodation tool. And it summarizes some ideas. And then it says, specific to Jennifer White, these are the accommodation tools that she uses on the iPad that give her equal access to the community, workplace, whatever it is that. And then there are you list those three things, those three reasons I use it as an accommodation tool, and you get the signature of the person and their doctor. And that's what you send into Medicaid or to the insurance company to justify the purchase as an accommodation tool. So that's on there. If you open iPad setup, if you click on that iPad, the document there, here's, if you don't know how to use an iPad and you just scroll down, you can just scroll a little bit, then it's going to show you page by page what to touch, how to set it up. This one is made mostly for staff and families because a lot of them don't know how to use tools. Okay, Donald, you can go back from this. If you hit the back button, it'll take you back to the main screen. And then ideas about how to get started for using documents, but go ahead and scroll. You don't have to open that one. We're just going to scroll down. Okay, that film that's been playing in the background, you can take that off the screen so we can stop watching it if you want. There are 5 lessons on how to make a silly film. When you're teaching technology, especially for people who've been managed their whole lives, so people with cognitive disabilities who are in rote, repetitive kinds of training all day long, you know, try to learn skill sets, this capacity to understand how to learn how to do it myself. And we print these out so they have a reference tool and they can keep looking at it to take themselves through the steps of what they're doing. If you open up lesson 1, this whole series teaches you how to make a silly film by taking pictures in Photo Booth. It's a silly app. Go ahead and scroll down to the next page. I'm going to have you walk through page by page for a little bit. We do the very basics. Hold the iPad this way. Next slide. We're going to open Photo Booth. This is what it looks like. And here's what, you know, touch it like that. Go ahead, next slide. It's going to open up into this screen. There's going to be 9 choices. You can just keep kind of moving, Donald, slowly through this. The next slide is going to show you, you're going to pick one of these and you've got a hand touching. Keep going. Don't regulate it to my speech. Just literally scroll. I'm going to take a picture. I'm going to show you that all of the pictures are kind of showing up underneath the photo you've taken. Here's how you go back. Here, now you're going to take a second and a third picture. And then we're going to close the thing down and you go to the home page by swiping or hitting the home button. And now we're back on the home page because now we're going to make a movie with those pictures. We open up iMovie, we touch the plus sign. Okay, you can stop there. So you're seeing that you can go back to the main 5 lessons. Thank you so much, Donald. You are just a great partner in this. So when I'm talking about how-to documents, I want to know how the individual can themselves look at the tool and understand what to do without being cued incessantly by someone from the outside or someone else doing it on behalf of them. So if I'm working with somebody who wants to make a video resume, we're starting right here. We're going to make silly films first because you're going to learn all the editing features in iMovie. And then we're going to start making structural films. Somebody in the chat said something. If you can go back to the website, Donald, to the front page of the website, so go back to the home button. Whoops. There you go. And just go, instead of home, sorry. Go under innovative accommodations and hover there for a second. If you look down here, you're going to see video resumes. Go ahead and open that page. And then scroll down. The first piece is there's a film, Kids in DC made video resumes. And so they're going to show you some ideas about how to do it. So there's some samples in that. And then on the bottom, these are downloadable tools. And if you'll open that, click that middle one, it's going to show you how we teach making video resumes. And again, this is a how-to document that we update on a regular basis. And just go ahead and keep scrolling, Donald. We're just going to give some an example of like, here's the why employers see a person with a, you know, with skill sets instead of the disability they don't understand. We give you some thoughts about how to use them. And then we go through, oh, we have a worksheet. We start there, we fill that out, et cetera, et cetera, et cetera. So you can stop right there and just go back to the main page. Thank you, Donald. You really are quite exceptional at this. So there are how-to documents on our website that you can look at as models. You'll notice in all of them, like, gosh, that video resume download, I'm going to need to change the color of that front page. But really, instead of changing the color of that front page, because it's hard to see the page itself because it's so close to the gray in the background, I'm going to have to change the gray in the background because the template for all of our materials, as you saw earlier in the sessions together, are based in trying to bring down the glare for somebody's eyes. So we use a light gray background with black print instead of black on white, things like that. So these are templates that you can use for models of how to think about developing training tools. Now, over the next 2 sessions, our last 2 sessions together, we're really going to hone in on finalizing those plans together. You can go back to the PowerPoint now, Donald. We're gonna go back to working on those plans so that when you all leave this 10 sessions with us, you've got some places to start, some possible first goals, some possible first steps. Definitely a lot of resources and ideas from the whole team, and then resources to go to utilize to actually keep making tools. The how-to documents are another place. Next week, we're going to work on more leveraging the model so that we're not trying to do it on our own, right? We're shifting a lot of to integrate technology. You don't want to be the only person, up at night trying to make those how-to documents for your meeting tomorrow morning. This is going to be a group community process of how do we keep this library live? Where does it live? How do we get more people involved in doing this? So again, Kim's comment about many hands make light work, because it's going to be an ongoing structure. I teach teachers how to do this and agency providers. We collaborate with local high schoolers to work on building things together, or local colleges and colleges that are teaching special education teachers, etc. People who are learning how to build accommodation tools is a really good place to collaborate to get some of these things done, and to know that you're doing it long term. Like we talked about at the very beginning when we met, that social justice model lens tells us that this is, right, we're here with pitchfork and shovel in hand, and we're going to keep digging, and we're going to have to keep looking at what's accessible. When am I the teacher? How do I make it so that it's more accessible to the person that it's supposed to serve? How do I get more people involved in building it and helping us turn this corner together? All right, next slide. Somebody made a comment or something, Dave. I'm just going to check real quick. Oh, okay, she tried to figure it out. Okay, it's all good. All right, so now we're going to go into small group strategies again. And here's what we want you to work on, because we're randomly going to assign you, other than the interpreters and the caption are going to be in one space. We want you to identify a starting something. What's the first thing that you need as a company to start to onboard people about how to use technology? Whatever technology you're starting with. If it's, we want the people we serve to be able to understand how to set up Alexa to connect with the thermostat and the lights in their house. Or we want people to learn how to make video resumes. Whatever the technology is, whatever the goal is, what's the starting document? Or film? How are you going to train it? What's the starting place? And then second, I want you to identify the development team. Who's going to be giving input about the content of these things? So I'm just going to disclose here right now, right? Those tools that I just showed you, I made based on my own experience of being in the field for, being an old lady in the field, starting at 13, being 61 years old now. But you know what I've really missed over the years? Certainly it's been informed by the people I work with. That's why I made them. But you know what? I did not involve people with lived experience in the development of the materials, for the same reason that most of us skip that step, because I don't have time. I don't have all of the reasons that, right, that perpetuate this marginalization model. So who can be on your development team? Where are you going to get feedback, direct feedback about the usability, the features that you're including, how things are clear, how do you make it in the most clear, accessible formatting? And then I want you to, excuse me, you're going to, spend some time together to make this little plan in your small group. You're going to identify what it is that you're teaching. Does it need a document or film? And you're going to identify the potential leveraging your community members and collaborators. And you're going to consider how you can create an opportunity for billable hours. So you're not bringing something into your structure that says, now my staff have another job on top of everything that they're doing. So how do we work billable hours into this? And then you're going to outline, I'm going to skip that last one for a little bit. We'll come back together and we'll talk about how to develop a template for the team so that anybody could make an additional piece, but we're not really there yet together. So that's what we're going to, does anybody have any questions before we do breakout groups? Identify the document or film, the starting place, create an opportunity for billable hours, and identify how you're going to leverage your community partners. Yes, Deb, I see your hand up.
Sorry, I know we always tell people don't do that while somebody's talking. And then I
No,
was
it's all good.
so we don't do that same, we don't fit into that model. So like, because we don't do billable hours, like we just use grants. So
Okay, cool.
so
So
we
your
just talk
answer-
about the first two.
yeah, perfect. So
'Cause we always say the first thing we need money to pay people to do it. So
well, there's
Yeah.
there's another piece. So how do you
Yeah.
get that? How do
Yeah.
you fund the time? That's
Yeah.
really the question, is how do you fund the time that it's going to take? Because this is a new ongoing need, not just a once and done. So how do we build that into the current structure that exists? Everybody good?
can
Any
I
more
ask
questions?
another? So billable. So because you had said this before, and I love this idea because like you picked on Scott. You don't have to pick on him because he's like he is what you're saying. Like he, not just teaching people how to do it, but having them teach other people how to do it. Because Scott, that's who he is. One of his many hats for us. But I love what you said earlier about charging for that. Like I mean, Rhode Island, we don't have a lot of people that know how to do what we do. So
Right.
That's could be
That's
our
right.
plan.
And so
Got that,
Scott, Scott, if you're teaching someone else how to do it, it's billable hours from that person, from on their account, because now they've got a skill set that carries forward the capacity to build their own accommodation tools. And that's a goal for everyone in our system, is the capacity to build that themselves. Beautiful. Anybody else have any questions or comments before we break into small groups? Everybody clear about the assignment? All right, I'm going to put you into small groups now. I don't have this. I don't have the group.
I will make you an a
Thank you.
co-host. Sorry, I didn't realize.
Thank
we
you.
were
No,
gonna do
no
that.
problem. No problem. All right, and make sure that you have a note taker. You're going to send the summary of what you worked on. We're going to come back and talk about it, but you're also going to email it to me, because I'm building that big, like, here's what the team all thought about. Here's some references for everybody. Thank you, sir. All right, so I'm going to break you into small groups. And we have a total 19. We're going to say 3. I'm going to say 2 to 3 people in each of this, because I want you to dig down deep and develop a plan. All right, here we go. Have fun. I'm going to be moving you around to make sure that the interpreters are in the right place. Welcome back. Did you have fun, Scott?
Yeah.
Excellent. All right, so people are slowly coming back in the room. Ten more seconds before they get booted out and are forced to join us again. Welcome back. All right. Welcome back, everybody. Thanks for playing. And now we want to
That's a long
do,
play.
that was a long what?
That was a long, seemed like I did the most of the talking. It just
All
seemed
right.
like very long.
Well, good to know. Typically, we don't give people enough time. Was that too long to do this task?
No, not really. It's just that, I'm with Temple University. We're already funded as far as AT. Our lending library is already established. It's been established for a long time. So when individuals are interested in different AT, as a resource coordinator, I'm the person that gets that AT that they're interested in from the Linden Library that they borrow for 9 weeks
Right.
to come here where I provide the support to them, okay, on how to work the device before a waiver pay for the device or funding from Temple, that they do have different fundings for the different devices, but they want each recipient to know how to work it.
Right.
So in that case of providing them with support, I'm the person that gives them only 2 hours, and we're not asking for funding, you know,
Right.
for them
So-
to come in.
Yeah, totally. So we're all coming from different kinds of, right?
But that's
needs.
what I was explaining to Mr. Bill, that you're very intelligent, you're very smart, you're trying to help individuals get an establishment, how to get the funding, how to grow with the AT, how to reach out and help other people. I'm already established, you
So
know.
I'm gonna say that there's not just the how to get AT out there, because AT's been available for a long time.
It's been right.
But hang tight for just a second, because smart screens change every year. So
Right.
even though you've done your training, how does the person not have to depend on their staff to keep getting cued to learn something new? That's
Well,
there's
see, every
challenge
year
there.
we
Yeah.
have to learn something new.
Right, but yeah, so I get it that you might not be in the same boat as everybody else.
Well,
but
that's what I said. That's what I
Yeah.
stated to him. And that's
Yeah.
where he was saying he wants to be like that. He wished that there was a Temple University there.
Right,
We
exactly.
all wish
Okay.
there was a Temple.
It was you
University.
and Billy meeting? Is that who you said you're partnering
Yeah,
with?
I enjoyed meeting with Mr. Bill. This
Yeah.
is how I'm raised, Mr. Billy. Yes.
Mr. Billy,
I
yeah.
was meeting with Mr. Billy, but like I explained to him, our reuse program,
Yeah.
okay? We know that insurance don't cover like they used to. They used to cover like a Cadillac.
Mhm.
Cadillac insurance were the best insurance.
Right.
You don't get the shower benches no more through
Mhm.
the insurance. You don't get the bedside commodes no more through the insurance. You don't get the sliding boards no more through the insurance. You probably won't get the manual chair. But what we do, we advertise. When my stuff go down, we're up on Facebook, we're up live. Hey, don't
Right.
put your nice stuff out on the road
Right.
or
You're
next.
talking about system changes. We're talking
Yes.
about delivery to the individual changes so that they're more in charge of
Right.
how to use it. That's what we're talking about here. But thanks for the report out. I'm going to check in with Billy just to complete your group to round
Okay.
out. But thank you for that feedback. And Billy, how about you? Did you get to think about how to create a document? What you might want to target to start
We know
with?
how to do, well, we know how to do the document development, and like what we do with our pre-fillable forms that we create for consumer intakes and stuff like that. But your Able Opportunity website, we showing the how-to, like how to do the iPad, stuff like that was way cool. Because usually what we do is we would share some people's YouTube that we've experienced through YouTube it's already made out there. But I like your how-to much better on your website that I saw, and it's very clear and concise. And I think it's more user-friendly for the people with disabilities than the YouTube ones that I see out there. So that's pretty cool. We have not created our own out here. And as far as the other part, we're talking about identifying the development team. We have a development team out there, but we would also like to branch out and, like I said here, we got the rural areas, some places that's far away.
Yeah.
And we would like to have some team members, like for example, recruit some of the college students that are out there who are learning to be computer tech, and utilize them as their volunteer time or intern time to go out there and help educate those individuals that have devices out there, how to get on Zoom, how to turn on your computer and get on your email or whatever, and do that, walk them through the process.
Beautiful.
We don't have that capacity at this time.
So
but we're trying to go that direction right now.
So the co-creation of those documents might be the way to address it when you do have the capacity, that you're looking for the college student to work with the person to develop the tool that looks like the stuff on Able Opportunities, that's more visually accessible to more people, that kind of thing. But I love how you're thinking about it, Billy. That's great. And because we have limited
Yeah, I
time, I'm
agree.
going to ask each group to keep it pretty brief, and I'm sorry about that, but you know how we are. I talked too much, so you have less time. Room number 1, Scott, can you tell us how it went for you? Did you get a plan in place?
Yep. How to use the apps and stuff on your phone, and show them how to do it. And they say, well, I got this too much on my phone and they don't know how to do it. We could film it and show them how to do it and stuff.
Brilliant. You could be with the person capturing footage, showing them how to do it, and they could walk away with that film.
Yeah, for other people can go on the YouTube and look back, and they can see what we did, and they know how to use it on their phone, and they can take this stuff off what they don't need.
Brilliant. I love it. Excellent. And then Elijah was in with you. Am I pronouncing your name correctly? It was in with Scott?
Lizer. It's fine to call me Eli. It makes things easier for everyone.
Eliza or Eli, however you like to be called. Any your takeaways here? Any starting places or possible collaborators?
Yes. Other video ideas of like possibly like assistive tools that aid in cooking.
Oh yeah. Brilliant. So again, then who would the collaborators be? Could you co-create them with people that you serve?
I'm having poor connection. I caught the last word. I'm not sure what you said.
I'm sorry. Any collaborators you're thinking about who you could develop the tools with, like the people that you serve?
Oh,
One
yes.
second, I'm still on the webinar.
Yes.
Very cool. All right. Jacqueline and Mariah?
Oh, I think I was partnered with Leslie.
Oh.
But for us, we identified that people need help with getting online, getting on Zooms, and actually accessing their emails and the links in the emails.
Yeah.
Setting up the email as in how to actually make an email, because half of the problem is that people don't open their emails or respond to people if they're like, hey, we have an event, are you interested? And they don't know how to respond to it. They don't know what they're doing with it. So we came up with an idea of the same age level, training the same age level. Like an elderly person needs to teach an elderly person, because in face-to-face, so they can show and the other person can see, and then they can redo it in front of them to make sure they're doing it correctly. The same thing with Zooms and email. You need to train them in person, because this is the whole thing. They don't know how to do online stuff yet.
Right.
So for them to understand it, they need to see it. They need to practice. They need to do it on hands. So
Right.
online is great, but they don't know how to get online. So you need to do it in person, so they know how to get
Right.
online.
And then the next step to that, Mariah, is, okay, we're working in person and we're capturing screenshot by screenshot, so I can print it out with you and you can take it with you. That's the
And you can have it right in front of you and say, oh, this sheet looks like this screen. So it matches
like
up.
that. Perfect. Just like that. Fantastic. Okay, Carlo, Deb, and Linda, you know what? I'm going to stop and say, actually, we're out of time. So I want all of you to send me the written notes.
I'm sorry if I went over.
No, it wasn't you. Put the data in writing to me at Jennifer@ableops.com. You all have my contact, just so I can put it in that bigger chart piece. And then next week, we really are going to start working on plans. We're going to look at the goals that we have, the tools that we have, and the starting places that we have, and start rating some functional goals. And this might be helpful too. This is going to be a good time to write it specific to your needs. So if you're at a USET, if you're at a day program, if you're providing employment services, regardless of where you are, that you're going to write it specific to the agency that you're working in. Okay. Thank you, everybody, for your time today. Sure appreciate it.
Have a good weekend.
You too.
Thank you, everybody. Thank you, interpreters. Thank you, Donald.
Thank you. Yes, thank you, Donald. Thank you, interpreters. Thank you, CART services. Appreciate that so much.